when we think about who would deliver babies, we would assume that it is done by a doctor. However, it may surprise you that midwives have assisted women in giving birth since ancient times. And today, midwives deliver more than 2/3 of the world's infants. All of us here were brought into the world through childbirth, and most of us here will someday bring children of our own into the world, probably with the help of a midwife. In high school, I decided that I wanted to be a midwife someday, and since then I have done much research on midwifery as a career. Today I will give some information about midwives. I'll tell you about the history of midwives, the education required to become a midwife, and different career paths within midwifery. I'll start by talking about the history of midwifery. The 6th edition Columbia Electric Encyclopedia, published in 2015, stated that the term midwife for centuries referred to a woman who was an overseer during the process of delivery. In ancient Greece and Rome, these women had some formal training. As the medical arts declined during medieval times, however, the skills a midwife possessed were gained solely from experience, and the lore was passed on through generations. With the upsurge of medical science about the 16th century, the delivery of babies was accepted into the province of physicians, and as formal training and licensing of medical practitioners became more prevalent, these requirements extended also to women still engaged in midwifery. At this time, professional schools of midwifery were established in Europe. Midwifery was only recognized as an important branch of medicine, however, when the practice of obstetrics was established. In the United States, due to rising medical costs and burgeoning interest in natural childbirth and more personalized care, there has been a resurgence of interest in midwifery since the early 1970s. Isn't it neat that women used to do this job without any formal education? Now I'm going to talk about the education needed to be a midwife today. Funk and Wagnall's New World Encyclopedia, published by World Book Inc. in Chicago in 2015, states, in the U.S., registered nurses who graduate from an approved midwife training program may become certified nurse midwives by passing an examination administered by the American College of Nurse Midwives, founded in 1955. This means that anyone wanting to become a nurse midwife must first become a registered nurse with a Bachelor of Science degree in nursing before they can further their education with a 2-year program to become a nurse midwife. Funk and Wagnall's New World Encyclopedia also states that midwives usually perform normal, low-risk deliveries, generally without the use of obstetrical forceps. They do not perform operative deliveries, such as cesarean section. Midwives may also provide a number of other birth-related services, such as give advice on diet and exercise, instruction, encourage husbands to take part in birthing, help the family adjust to the infant, and provide follow-up care for the mother. For non-pregnant women, certified nurse midwives perform gynecological checkups, breast examinations, and pap tests, and provide birth control advice and other services. Ian Peach and Kathy Hamilton's The Student's Guide to Becoming a Midwife, published in Hoboken, New Jersey by Wiley in 2014, says that it is important that midwives work collaboratively with other healthcare professionals, including obstetricians, pediatricians, specialist community public health nurses, and paramedics, in order to ensure high quality of care for women and their families. After completing all of the necessary courses and examinations to become a midwife, one must then decide where they want to work. Midwives can choose from several different workplaces. Also stated in Funk and Wagnall's New World Encyclopedia, midwives deliver babies in such settings as rural outreach centers, hospitals, home-like freestanding childbearing centers, and especially in the case of direct entry midwives, private residences. Now that I have covered all of my points, let me go over what I have talked about. Today I told you some basic information about midwives. I told you about the history of midwifery. I told you the necessary education needed to become a midwife, and I told you some different career path options for midwives. Midwives have changed a lot since they first began practicing so long ago and are very popular in childbirth today. I hope that you remember some of the information that I told you today if you need a midwife in your future.